Hello, JPU family. Welcome to another episode. If you're new to this channel, welcome. Returning subscribers, welcome back. So, guys, there's a new report out that there are 24 reported deaths of premature babies at the Victoria Jubilee Hospital. I've read the report and I've also read what the opposition had to say in response. Of course, the opposition is, trying to stir up a scandal here, but it's not working because the explanation given by the head of the hospital and the chief medical personnel in the country, plus what we know about premature births, it just makes sense. Let's go into a little more detail. So it is a thing. No matter where in the world you live, no parents want their baby to be premature, because when a baby is premature, they have a higher risk of having long-term medical issues or not making it, if you know what I mean. According to data, neonatal mortality rate in Jamaica is about 17.9%. In the US, it's about 14%. Before I go any further, it's important to note that these babies who passed, they did not pass as a result of any infection or outbreak. According to the data and the medical experts, the babies passed due to issues related to premature births. The Gleaner reported that the Ministry of Health and Wellness sought to calm public concerns following reports that 24 newborns have died at the Victoria Jubilee Hospital since June 1 of 2025. In a release late yesterday, Thursday, the Southeast Regional Health Authority, which oversees the hospital, said data collection indicates that the majority of the affected babies were born prematurely with significant factors that could have predisposed to serious illnesses. They said that there had been a notable increase in admissions to the special care nursery when compared to both previous months and the same period last year. The increase reportedly brought with it a higher number of critically ill infants, many of whom were born prematurely or with a low birth weight. They added that it activated its surge plan and took all appropriate steps to care for the babies. Of course, with the concerns of the public, guys, we reflect on the 19 premature babies that died in 2015 at Cornwall Regional and at the University Hospital, right? Also, we had, and those were from infections. Also, we had some babies, 9 babies actually, who died of infections as well in July of 2022. There was a reported bacterial outbreak at the Victoria Jubilee Hospital. They said at the time that 2 deaths were reported in August and 2 more in September, giving a total of 13. In this case here, the Chief Medical Officer, Dr. Jacqueline Bassaser Mackenzie, made a statement addressing the current situation. Quote, "The deaths are not attributed to an outbreak of infections. What we are seeing is an increase in the proportion of critically ill babies. Of the babies who died, 55% were premature and 65% had low birth weight. This adds significantly to the fragility of these babies." She went on to say, despite the best efforts of the staff, some of these babies have unfortunately succumbed to their illnesses. This is deeply saddening and we extend our sympathies to the families, unquote. She further sought to explain that the country was entering a time when births typically increase and health teams were working to be ready. She said, quote, "We are at the beginning of the period when we generally see a rise in the number of births. Every effort is being made across the island to prepare our healthcare workers and our facilities to adequately manage all cases. Meanwhile, the people who oversee the hospital, guys, said an ongoing investigation into the recent deaths of babies is being conducted in partnership with the Kingston and St. Andrew Health Department and the team at the Victoria Jubilee Hospital, with additional support from the Ministry of Health and Wellness. As part of its response, the people overseeing the situation said it had increased spacing between babies, reinforced infection prevention and control protocols, redeployed staff, and strengthened the monitoring medical supplies and equipment. Further, they said that they extended their condolences to the families who have lost their newborns and committed to providing a full public update once the investigation is complete. The authority reiterated its dedication to ensuring the highest standards of patient care and safety across all its facilities. According to data from the Pan American Health Organization, Jamaica recorded progress in maternal and infant health outcomes between 2006 and 2020. That's good to hear. During this period, the infant mortality rate declined from 21.1 to 16.7 deaths per 1,000 live births, a reduction of approximately 20.9%. In addition, the maternal mortality ratio of 2020 was estimated at 98.9 deaths per 1,000 live births, representing a 19.1% decrease compared to the estimated figure for the year 2000. So the other side of this story is the opposition's response. According to the Jamaica Gleaner, opposition rejects explanation given for spike in neonatal deaths at Victoria Jubilee. Alfred Dawes is the opposition spokesperson on health, and this is what he said.
The Southeast Regional Health Authority has confirmed that 24 babies died at the Victoria Jubilee Hospital in the first 24 days of June. Reports indicate that 229 neonatal deaths at the hospital between October 2023 and 2025. The Minister of Health, Dr. Christopher Tufton, must confirm whether these figures are accurate and release the full mortality data from 2020 to the present. The explanation given that prematurity is the cause of these deaths is unacceptable. Prematurity is a medical condition, not a cause of death. This points to a deeper systemic failure in the care for newborns. Victoria Jubilee continues to suffer from overcrowding, understaffing, and outdated infrastructure. There's a chronic lack of essential resources, including cooling blankets, ventilators, and proper parenteral nutrition for neonates. These deficiencies, combined with inadequate staffing, compromise the hospital's ability to manage high-risk pregnancies and provide life-saving neonatal care. Jamaica's maternal mortality rate is now higher than it was 30 years ago. Combined with a spike in neonatal deaths, this reflects a public health system in crisis. Dr. Tufton must answer the following. How many neonatal deaths have occurred at VJH annually over the past 5 years? What has been done to improve these outcomes? What budget allocation was made to neonatal care? Was there a breakdown in infection control? And importantly, why was the public not informed sooner? Jamaicans deserve transparency and accountability. These were not statistics. These were children.
So we're not going to spend too much time on this response because Alfred Dawes is being very disingenuous here in saying that premature birth is a medical condition, but it's not a cause of death. That is not true. Yes, it is a medical condition, and it certainly can be a cause of death. So that statement is wrong. The next thing is, when he spoke about maternal mortality rate in Jamaica, so ever since 2016, the maternal mortality rate increased, and especially after COVID-19, right? But what are the historical facts? It is not because of the government of Jamaica why we are seeing higher maternal mortality rates. The leading cause of maternal mortality rate is things like hypertensive diseases of pregnancy, hemorrhage, ectopic pregnancies, pulmonary embolism, and sepsis. Also, you have the socioeconomic factors as well. So, people need to be educated and certainly must have access to prenatal care and care for mothers during pregnancy. Unfortunately, there's always going to be neonatal deaths and deaths of mothers during pregnancy and, having babies. That's just a part of life. It's a sad reality, but it is the reality. But the healthcare system's duty is to make sure that we are minimizing these kind of things as much as possible, even though we'll never be able to stop it completely and have zero cases. This is a sensitive issue for me. Growing up, my best friend lost her mother during childbirth. Her mother was having her sixth child. My best friend's mother, at the time, she was one of the most beautiful women I've ever seen. Her mother ended up raising her children. As for Alfred Dawes and this blame game, the blame undertone that they like to play, it is ridiculous, it is disgusting, and whatever data he's requesting of the health minister, he can request it from the people them who oversee these facilities, like Victoria Jubilee. He can get the data there, So this is just mischief making, and it is exploiting a terrible, terrible situation. Guys, this is Jamaica Politics Uncovered. Keep it locked here. Make sure you're subscribed. Thank you for watching. I'll catch you in the next video. Let me know what you think in the comments, guys. I'll be reading them.
Jamaica Politics Uncovered. Pick up yourself, because you don't know you will discover. Lord of mercy, hey. Some a say that them a diatic, and them a suffer to hell neurotic. Them a say that them a diatic, and them a suffer to hell neurotic.